I do have like two other questions. Dr. Bell, your testimony suggests that small firms can make important contributions to advances in medical research because the firms are willing to explore new approaches. Given the SBIR program's emphasis on commercialization, are you concerned that participating federal agencies may not have an adequate incentive to fund high-risk research topics?
You know, if you'd asked me that question 20 years ago, I would say I would have grave concern about that because I think, fortunately, the NIH has done a terrific job in terms of making sure that they've developed review processes that are set out to identify opportunities and new technologies and move forward. Initially, when they had their review processes, it was mixed up with the regular peer review process of regular research grants, and I think it provided some confusion to the reviewers. Now they have specialized panels that are looking for innovation and new technology. So the fact that we have PTC 124 suggests to me the system is working. Nanoparticles to look at gene therapy suggests to me that the SBIR system is working at the NIH. So again, we always have a concern at the NIH whether we are looking for innovation and so forth, but I really believe and I really commend Dr. Zahuni and the staff for making sure they put mechanisms to be able to look for innovation and new opportunities.
And Mr. Dorfler, can we talk about the application process? Your company has applied for SBIR and won SBIR awards. Do you have any recommendations about how this process can be improved?
Yes, I've been saying it several times. The key one is consistency and clarity in terms of who is eligible. And it's not around the change in your capital structure, which I think is an artificial way of judging a company's size. When we raised our money, we still are about 20 people, so we didn't change. I think the process is quite good, as Dr. Bell said. The peer review at NIH is superb. The people who are reviewing in those study sections really understand the area. They understand the mandate that NIH has to improve public health. So we're very comfortable with. The only thing I would also add is that perhaps more flexibility at the agency level for them to provide different amounts if they feel that the science, again, and the opportunity warrants a larger amount.
Does any of the other witnesses have any recommendations regarding the application process? Yes, Mr. Boros.
Again, I would refer you to the Academy's findings. There were a number of programs at some of the agencies that involved electronic submission, electronic evaluation, which seemed to speed up the process significantly, could be more widely adopted.
Well, let me take this opportunity again to thank all the witnesses, and I know how important this program is for small businesses, for innovation and technology in our country, and for our economy, and for small businesses in particular. We will continue to give serious consideration to the reauthorization process. With that, I ask unanimous consent that members will have 5 days to submit a statement and supporting materials for the record. Without objection, so ordered. This hearing is now adjourned.